Hello, my name is Mary Cacioppi, and I have the honor of serving as a national consultant with the AHA process. Today, I'm going to share with you how to create and manage a Bridges Out of Poverty community of practice. I also serve as the executive director of One Body Collaboratives, a faith-based nonprofit organization located in Rockford, Illinois. We launched our Bridges Out of Poverty initiative about 3 years ago. And we have learned so much over the last 3 years in terms of what it takes truly for a community to launch and maintain this effort. My background is in community and economic development, spending over 16 years working for and managing chambers of commerce and economic development organizations. So this work is very exciting to me and draws on my strengths in community development. Key points that I will cover in today's webinar include using community data to create the case for collaboration, organizing your initiative using the collective impact model, determining who your community stakeholders are, and launching and maintaining your community of practice. I'd like to provide just a little bit of background about my organization, One Body Collaboratives, just to give you some context as to why we launched our Bridges Out of Poverty project. Our work is done in 4 key areas: meeting basic needs, coordinating resources, helping our community to flourish, and reducing poverty. What we find many times is that we're simply putting the Band-Aid on the crisis of the day and not really getting to the core issue that created that crisis for the family that we're serving. We wanted to take a more proactive approach by helping individuals in poverty by providing them with a way to build their resources and not just provide that resource to them. One of the founders of our organization, Alan Barcima, wrote a book called Bridges to Wholeness, which was published by the AHA process. Al suggested that we look further at Bridges Out of Poverty and how we could implement it within our own community. After researching the AHA process and learning more about launching this Bridges Out of Poverty initiative, what we realized is that this really is an initiative that can create so much value for our community if our entire community was invested. And we set out to create a community-wide effort to reduce poverty. We started with trying to better understand what poverty looks like in our community. According to our community data, our metro area had a poverty rate of 14.7% in 2019, ranking us at 47 out of 101 comparable communities. In comparison, the best community ranking in this area was 8%. An area of concern in our community data is generational poverty. In 2019, 23% of our residents under the age of 18 were in poverty. This ranked us at 69 out of those 101 comparable communities. Generational poverty is defined as a family having lived in poverty for at least 2 generations. We feel that by providing a way for the parents of these children to build their resources and become self-sufficient, we can greatly impact that generational poverty cycle. Another area of concern is the number of full-time workers living in poverty. This moved in ranking from 34th in 2017 to 77th in 2019. We believe that Bridges Out of Poverty and its workplace stability program can greatly assist our community in this area. United Way of Illinois reports that 23% of our residents in our county are in poverty, or what they call ALICE households. ALICE stands for Asset Limited, Income Constrained, and Employed. These are households that earn above the poverty level, but not enough to even afford a bare bones household budget. Again, this is another data point and opportunity for us to talk to our local employers about implementing workplace stability. So a question, do you know how to access the poverty data within your own community? A national resource is census.gov. You can find information here on your state, drill down to your MSA, to your city, and even information on specific census tracts. And some local or regional resources that you could tap into would be your local city or township, your chamber of commerce, or economic development organization. We are using the collective impact model to guide our work. One Body Collaboratives serves as the managing backbone organization to implement this project within our community. Throughout our Bridges Out of Poverty community of practice, we have continuous communication about the project, mutually reinforcing activities, shared measurements of our results, and a common agenda throughout our entire community. These align directly with the steps outlined by the AHA process in developing a Bridges community. These include embedding Bridges constructs within individual organizations, developing a critical mass and doing that community-wide training on Bridges, engaging people in poverty using Getting Ahead, developing a community-wide collaboration, system-wide evaluation, expanding to all sectors, and sharing best practices. It's also important to remember that Bridges is not a program. It is a set of constructs and strategies that people, organizations, and communities use that will improve relationships at the individual level, improve outcomes at the organizational level, and change systems at the community level. Institutions and communities use these concepts to improve programs or to develop new programs. And it's really meant to complement or contribute to the good work that is already being done. Bridges also helps to prevent poverty, alleviate suffering, support people in transition from poverty to self-sufficiency, and create communities where everyone can live well. Guiding principles outlined by the AHA process were shared with our community of practice when the group officially launched. These include focus on practice and action, that all three classes, poverty, middle class, and wealth class, must be at the table, changing thinking and behaviors. That action is guided by the experience and knowledge of those folks in transition. That we're bringing all classes, races, sectors, and political persuasions together. That we're stabilizing the environment and building resources, addressing all causes of poverty, providing long-term support for those in transition, and creating a sustainable community. Organizational principles to keep in mind as you're creating your community of practice include that everyone owns it and no one owns it. Don't wait for authorization to act, and that transparency really is one of the keys in this process. Our next step was to create a project team, which included key community organizations who have a vested interest in reducing poverty using this comprehensive community-wide approach. This included representation from our local city and county government, our community action agency, our local health council, housing authority, library, and workforce connection, and national organizations like Goodwill, United Way, and the YMCA. These early adopters of the program helped to guide the project as we launched our effort, served in an advisory role, and helped us to get others on board. We hosted our Bridges Out of Poverty community workshop as an online event due to COVID and had Terry Durusi Smith, a national consultant with the AHA process, present our full-day workshop. We had 133 participants from 68 unique community organizations that participated, and we felt this was a really great launch. This was instrumental in getting our entire community on the same page and then moving forward together. It took a major marketing campaign to attract that audience. This included hard copy invitations, as well as an email campaign to key community leaders and many, many social media posts, all explaining the importance of attending this full-day workshop. We also filmed a brief 2-minute video introduction and invitation that explained why we felt that this was the solution for our community. As we know, poverty touches all sectors in our community, and each sector provides programs and services to reduce poverty. However, each sector is mostly doing this work independently. We wanted to remove the silo approach and introduce a common language for all of these sectors to work together. We also wanted to provide a platform where all of these sectors could come together and learn from one another. Using the graphic provided by the AHA process shown here, we started to determine which community organizations represented which area and listed out those organizations representing those sectors. This really helped us to better understand who could or should be engaged, and we started inviting people to join our quarterly community of practice meetings. The community of practice provides a platform for us to bring key community leaders together to reduce poverty in a comprehensive way. We launched our Bridges Out of Poverty community of practice in January of 2021 and continue to host quarterly sessions which are focused on how to implement the Bridges constructs and strategies within each organization, and also discussing the barriers or policies that could be changed at the organizational and community level to better serve those in poverty. Each quarter, we have anywhere from 25 to 45 participants in these conversations. When we launched our community of practice, we began to wonder what we were going to discuss and how we were going to engage people in our community, especially because our meetings were going to be held by Zoom due to COVID. Our quarterly meetings in our first year included a panel discussion with local organizations talking about how they have already begun to implement these Bridges constructs and strategies within their individual organizations. We also hosted a panel discussion with other communities across the nation, understanding the success that they have had by creating their community of practice. And we also had an overview of the Getting Ahead curriculums, really to help our community organizations better understand which curriculums fit best with which type of sectors and organizations, and how they would go about implementing the curriculum. So if you're familiar with the Getting Ahead curriculum, you'll recognize this chart. This is one of the activities that the investigators complete in which they assess their own community. We share these assessments with our community of practice so they can better understand the barriers in our community or the lack of community support for those in poverty and transitioning out of poverty. This year, we wanted to take a more focused approach and determined the top 4 sectors in our community that we wanted to engage in these quarterly discussions. This year, these included housing, workforce, healthcare, and education. Each quarter, we are hosting a panel from each of these sectors discussing how they are reducing poverty through the way that their services are delivered and how they are working with others within and outside of their own sector to remove barriers and change policies to better serve those in poverty. We keep an Excel spreadsheet with everyone who attends our quarterly community of practice meetings. We can start to not only track how many people are attending, but also which sectors are represented and who is attending most often. We also have ongoing discussions within each sector about the ways that they can actively move this work forward through additional trainings, curriculums, and resources available through the AHA process. We are currently working with nonprofits in our faith community to continue our implementation of the Getting Ahead in a Just Getting By World curriculum. We are also starting to have conversations with our local county government to implement Getting Ahead while getting out, and also having conversations with our employers to offer Getting Ahead in the workplace. We continue to provide ongoing community trainings using the triple lens approach and looking at poverty through the individual experience, really helping our community to understand the complexities of poverty. We also talk about how we can implement bridges within individual organizations, agencies, and nonprofits, and how we are implementing this really as a true community collaborative. We also use the criteria provided by the AHA process to understand how we are progressing in terms of becoming a Bridges community. We have made our way through the list here on level 1 by creating that critical mass in our community and implementing the Getting Ahead curriculums. We have a pretty good start on level 2 in terms of engagement, but have some work to do in terms of the institutional applications of this work. It truly does take a concerted effort over several years, but we are also working toward level 3 in terms of policy and advocacy and overall community impact. So how do we fund these efforts? I'm sure we would all love to see this sign. When we launched this effort, we also had to create an income stream to support it financially. We have been blessed to have received grants from our local community foundation, the state of Illinois, faith-based organizations, and local and regional endowments and grants. What these funders truly love to see is the level of collaboration and the number of partners that we have in this work. One of our recent grant requests included letters of support from 16 community partners. We also provide an annual report for our community stakeholders on our efforts outlining our measurable results. This report is also posted to our website, on our social media, and makes a great addition to those grant requests. And finally, we launched a Facebook group, Bridges Out of Poverty Rockford Region. This keeps our community up to date on our project and also provides a platform for us to share information about events and best practices that we are learning from other communities. My contact information is provided here. Please feel free to reach out with any questions that you might have. Thank you for your time today and learning more about Bridges Out of Poverty Communities of Practice.